Hello learners, welcome to lecture 60, the final session of the module and the course. Throughout our journey, we have examined ethical issues, advocacy and global perspectives in reproductive and child health. Today, we turn to the future. What emerging issues are likely to shape RCH in the coming decades? How can social work with its focus on empowerment, advocacy and holistic care address these challenges? This lecture will explore technological innovations, demographic shifts, climate change and evolving social norms while highlighting the indispensable role of social workers and sociologists and public health physicians in building resilient, equitable and right-based RCH systems. Looking ahead is vital because reproductive and child health is dynamic, influenced by demographic, environmental and technological changes. Anticipating new challenges allows us to prepare systems that are responsive and resilient. By exploring future trends today, we ensure that tomorrow's policies and services are proactive rather than reactive. Sustainability in RCH will depend on foresight, planning and adaptability, with social workers playing key roles in bridging systems and communities. The future of RCH will be shaped by major global shifts. Demographic transitions mean aging populations alongside persistent adolescent health challenges. Non-communicable diseases such as diabetes in pregnancy will grow in importance. Urbanization and migration will reshape health needs and service delivery. Climate change will create new vulnerabilities from malnutrition to disease outbreaks. These trends demand integrated and future-oriented responses. We will need double duty strategies, programs that serve adolescents and older women while preventing and managing non-communicable diseases in pregnancy. Urban and migrant friendly services should sit alongside stronger rural outreach. Climate resilient health systems, safe water, heat ready facilities, reliable supply chains and emergency transport will protect mothers and children during shocks. Finally, use real-time data and simple dashboards to stop gaps early and quickly, keeping the poorest and most remotest families at the center. Technology is transforming RCH. Digital health platforms and telemedicine expand access to remote communities. Artificial intelligence offers tools in predicting risks in pregnancy or optimizing immunization schedules. Data-driven decision making enables real-time monitoring and evaluation. Social workers will need to adapt using technology to enhance outreach, advocacy, and client empowerment. With technology comes ethical complexity. Protecting patient confidentiality in digital systems is critical. Equity concerns arise when poor or rural communities lack digital access. There is also the risk of over-reliance on technology undermining human relationships in care. Social workers must advocate for ethical, inclusive, and people-centered use of technology in RCH. Climate change poses serious threats to RCH. Food insecurity will exacerbate maternal and child malnutrition. Rising temperatures may increase vector-borne diseases like malaria, affecting pregnant women and children. Climate-driven displacements creates new vulnerabilities with disrupted maternal care and child protection. Social workers must integrate climate resilience into advocacy and service delivery. We should design climate resilient services, safe water, shade, cooling and reliable transport for emergencies so care continues during heat waves and floods. Early warning systems or simple risks map can guide outreach to pregnant women and families with young children before a disaster strikes. Nutrition support must be strengthened through climate smart agriculture linkages, cash or food transfer, and regular growth monitoring. Social workers can lead community drills, coordinate shelters with mother and baby spaces, and ensure protection services for displaced children. Finally, all data and plans should track equity so the poorest rural and migrant families receive timely support first. Migration and urbanization are reshaping health landscapes. Migrants often live in informal settings with poor access to RCH services. Women and children in these contexts are vulnerable to exploitation and neglect. Continuity of care is disrupted as families move. Social workers are critical here, linking mobile populations with consistent rights-based health services. Take services to where people live and work. Mobile clinics at construction sites and evening weekend sessions near slums. Use multilingual counseling and a no documents, no denial approach so care is not blocked by ID issues. Give families portable health records and send SMS, WhatsApp reminders so care continues across districts. Map high mobility clusters. Assign a nodal ASHA link worker and run catch-up drives for immunization, antenatal and postnatal care. Connect families to social protection and referral for violence or child protection and track results with simple equity indicators to be sure no groups is left behind. The rise of non-communicable diseases like obesity, diabetes and hypertension is reshaping RCH. These conditions affect maternal health and have intergenerational impacts on child's development. Integrating non-communicable disease prevention into reproductive and child health programs will be essential. Social workers can promote lifestyle changes, community awareness and early interventions. Mental health is a growing issue in RCH. Maternal depression affects not only mothers but also child development. Adolescents face rising rates of anxiety, depression and suicide. Stigma and lack of services often prevent access to care. Social workers must lead advocacy and service delivery in mental health, normalizing conversations and expanding support systems. Gender and rights will remain central. Persistent inequality will continue to limit access to care for women and girls. Emerging debates on reproductive technologies like surrogacy and genetic selection will pose ethical dilemmas. Expanding inclusion of LGBTQ plus individuals in RCH services is another priority. Social workers grounded in rights-based approaches will play key roles in ensuring equity and dignity. Social work is uniquely positioned to uphold rights in RCH. Social workers advocate for equity in access, empower communities to demand services, and safeguard vulnerable groups such as adolescents, migrants, or children with disabilities. Their holistic approach ensures that emerging challenges are addressed within ethical and rights-based frameworks. Social workers are adapting technology for empowerment. Digital counseling platforms expand access to reproductive health guidance. mHealth tools support community outreach and track service access. Social workers can also use technology to monitor program gaps and ensure accountability, bridging the divide between systems and people. In the face of climate change, social workers play crucial roles. They support displaced families, ensuring maternal and child health needs are met. They advocate for climate sensitive policies that integrate RCH concerns. At the community level, they help build resilient networks that can withstand crisis, protecting vulnerable populations. Social workers are frontline actors in mental health with RCH. They provide counseling to mothers experiencing postpartum depression and adolescents facing crisis. By reducing stigma, they encourage help seeking. Social workers also link clients to mental health services, ensuring care is continuous and holistic. Globalization makes RCH challenges interconnected. Social workers contribute by addressing cross border health issues such as migrant maternal care or international adoption. They share advocacy rights with peers globally, learning from diverse contexts. By building solidarity across nations, social workers amplify advocacy for universal reproductive and child health rights. Create referral pathways so migrant women and children can access care without fear or paperwork barriers, and use portable health records to keep services continuous across borders. These are the practical actions which can be added. Join regional and global networks to swap simple tools like policy briefs, training modules, and hotlines that others can adapt quickly. Promote right based standards in plain language and local translations so families know their entitlements wherever they are. Track equity indicators for mobile and stateless populations and feed results back to policymakers to fix the gaps. Finally, pair online collaboration, partnerships on the ground, turning global solidarity into real services for mothers and children. Social work practice is evolving with innovations that make RCH advocacy more inclusive. Community led monitoring allows local people to track services. Peer support groups empower mothers, adolescents, and survivors of violence to share experiences and solutions. Participatory advocacy ensures community voices shape RCH policies. These innovations make services more responsive and equitable. Addition of simple steps like co-creation of scorecards with communities and sharing of updates after each review. Trained peer facilitators provide safe meeting places and link groups to services like legal aid, shelters, or cash benefits. Use of short local language briefs and WhatsApp hotlines so feedback moves quickly from community to the decision makers for quick action of fixing the gaps. Track improvements with a small dashboard of coverage gains, fewer stockouts, or better respectful care. Disaggregated by gender, wealth, and location to ensure equity. The role of social workers in HIV care illustrates their impact. They provide counseling to women and children, support adherence to treatment, and fight stigma in communities. Their advocacy has led to policies ensuring access to treatment and protection of rights. This case shows how social work combines service, advocacy, and ethics in practice. They also coordinate case management, linking clinics, schools, and social protection so families get transport, nutrition, and childcare support. Social workers set up peer groups and youth friendly spaces which improve adherence and reduce stigma. They protect confidentiality, use safe partner notification options, and create safety plans where there is a risk of violence. When discrimination occurs, they document cases and connect clients to legal aid and grievance systems. Finally, they track simple indicators: retention in care, viral suppression, missed visits, and use this evidence to advocate for better services and fair policies. In emergencies, social workers are critical to child protection. They safeguard children from exploitation, trafficking, and abuse. They help families and communities rebuild systems of care. Their interventions highlight how social work bridges humanitarian response with long term welfare and rights protection. On the ground, they set up safe, child friendly spaces, register unaccompanied or separated children, and work on family tracing and reunification. They provide psychological first aid and create simple safety plans linking children to healthcare, shelters, schooling, and cash or food support. Social workers coordinate with protection, health, and education teams, establish confidential reporting channels, and ensure confidentiality and informed consent. They also track risks and outcomes with a few clear indicators so service improve quickly and the most vulnerable children are reached first. Social workers strengthen RCH through education. They promote health literacy among parents, empower adolescents through education about rights and choices, and help integrate health programs into schools. Education as a social determinant of health is central to social work's contribution to future RCH. Collaboration is essential for future RCH. Social workers engage in multidisciplinary teams with doctors, nurses, and educators. They partner with NGO and government agencies to expand service reach. Most importantly, they engage communities as equal partners in designing, implementing, and monitoring programs. Building advocacy capacity is the key for the future. Social workers must be trained in policy influence, learning how to present evidence effectively to decision makers. They can use data to strengthen advocacy campaigns. By developing leadership within communities, they ensure advocacy continues beyond external interventions. Addition of simple steps like run short workshops or making one-page policy briefs with clear slide decks and a 60-second pitch. Setting up mentorship with experienced advocates and officials so social workers learn negotiation and timing around budget and review systems. Creating community advocacy teams that track local data, then agree on asks and meet authorities regularly. Use a small dashboard to monitor promises kept, policies changed, funds released, and services improved, and share updates. Finally, grow youth leaders and peer champions so advocacy remains strong even when external projects end. The ethics of RCH will expand as new technologies and challenges arise. Rights framework will need to adapt to debates on surrogacy, genetic editing, or digital privacy. Strengthening accountability, ensuring policies and providers respect rights will remain a global priority. Social workers will play crucial roles in ethics, decision making, and advocacy. Youth will increasingly drive RCH advocacy. Young advocates use digital tools and grassroots organizing to demand rights. Social workers can mentor these advocates, ensuring that energy is guided by ethical principles. Building intergenerational solidarity ensures continuity and sustainability of advocacy movements. Global trends like Sustainable Development Goals and post 2030 developmental agendas will continue shaping RCH priorities. Shifting donor priorities may create funding and uncertainties, demanding stronger local advocacy. A growing global focus on equity ensures that marginalized voices remain central. Social work must align its practice with these global commitments. Building advocacy capacity, as we know, is a key to the future. Social workers must be trained in policy influence, learning how to present evidence effectively to decision makers. They can use data to strengthen advocacy campaigns. By developing leadership within communities, they ensure advocacy continues beyond external interventions. Set up mentorship with experienced advocates and officials and create community advocacy teams that track data and meet regularly with the authorities. Use of small dashboards to monitor progress and give updates. Finally, growth of youth leaders and peer champions so advocacy remains strong even with external projects come to an end. The future of RCH will be unpredictable, shaped by crises like pandemics, natural disasters, or political shifts. Social workers must embody resilience and adaptability, navigating uncertainty, responding to crisis, and innovating with constraints. Their flexibility will be vital for sustaining RCH services in challenging contexts. To summarize, reproductive and child health will face new challenges from demographic shifts, technological innovations, and climate change. Social work ensures equity, rights, and empowerment in responding to these challenges. Advocacy and innovation will guide the future, keeping RCH responsive, ethical, and resilient. In conclusion, the future of reproductive and child health will be defined by how well we collaborate across disciplines, uphold ethics, and empower communities. Social work leadership is indispensable in ensuring that emerging issues are addressed with compassion, justice, and foresight, and suggested, with a collaboration across different fields and different people who work as sociologists or public health experts. The profession's holistic and rights based orientation makes it central to the future of RCH. Reflecting on the closing thought, social work is the bridge that connects health systems with the people. In addressing future RCH challenges, social workers ensure the policies and programs do not remain in paper but reach those who need them the most. They embody the link between ethics, advocacy, and community well being. This marks the conclusion of Lecture 60 and Module 8 Ethical Issues and Advocacy in RCH. Over this module, we have explored ethical dilemmas, informed consent, advocacy, policy influence, global perspectives, and future directions. Together, these lectures have shown that RCH is not only a technical field but also an ethical and a social one. Remember that the ultimate goal of reproductive and child health is not just better health outcomes but healthier, more just, and more empowered communities. Thank you so much for your patient listening. Thanks.